I would start just kind of by talking about what is a patient-centered outcome. And you kind of think about a patient-centered outcome being anything that's important to a patient. Some of those outcomes are the same as what we think are important. So, I'm a cancer surgeon, and so the things that I think are important are, doing a high-quality, good cancer surgery. Did I completely remove the cancer? And as I see that patient in follow-up, are they cancer-free? That's a very common sort of clinical context to the outcomes of the patients that we treat. But patients often raise our awareness of other outcomes that are also incredibly important that we may de-emphasize. And so oftentimes we think about quality of life, and so it's very easy for us to get distracted by the cancer outcome and forget to focus on patients' quality of life outcomes. Sometimes it's other things, like if my cancer was successfully treated, but the treatment itself made me financially burdened, that's a negative. So a patient-centered outcome might be high-value care that is a positive health outcome, but also a positive for the financial distress that it might impose upon a patient. So in general, a patient-centered outcome is anything that's important to patients. In GU cancers, probably the bulk of research on this has been around prostate cancer and bladder cancer. And in prostate cancer, there have been a number of registries that for many years have been ascertaining the quality of life of prostate cancer patients, and that has helped us better understand kind of the natural trajectory of the survivorship care of prostate cancer patients and how we can address some of the survivorship needs of prostate cancer patients. Much more recently, we've had some organized efforts to understand in bladder cancer what research questions are important to patients, and then as we think about those research questions, how we can operationalize a system to understand what outcomes are important to patients. And they're not always things that we recognize, and so that's a huge highlight of the importance of, and I know it sounds silly, right? It sounds like we should have been talking to patients about what outcomes are important to them this whole time, but in general, researchers think they have a good idea, and we almost impose that idea on our patient population. This new paradigm of research is to say, well, let's start this partnership early in this process. What do you think is a good idea? And then how can we create a research design that addresses this idea in a way that you think is meaningful and that is going to meaningfully answer the questions that you think are important?